My name is Jessica Allen.
Hi, my name is Alyssa Hawkins.
My name is Aubrey Otterson, and we are BYU nursing students who have been studying bedside shift report this semester.
So we came up with a procedure to do to implement a standardized bed shift report at an AJA hospital, which the effective date will be January 1st. And the purpose of this is just to implement bedside shift report training in a medical surgical unit for all nurses to improve patient safety as well as patient and nurse satisfaction.
Yeah, so just a little bit of background on why this is so important. There are around 200,000 deaths in the medical field due to medical errors, and a lot of that is because of miscommunications. Whether that's between the whole hospital as a whole, but we studied specifically between nurses to nurses miscommunications. And we found through several research articles and from evidence-based practices that when you have a bedside shift report compared to a nurse's station shift report, the miscommunications go down significantly. And in order to increase how often nurses are using bedside shift report, trainings can be done to increase compliance with this.
This policy will involve all nursing staff within the medical surgical department of AJA Hospital, and an annual training will be required in which we explain and teach them how to use a standardized bedside shift report tool. It is the policy of AJA Hospital to provide the best patient safety and care, and to provide the best satisfaction for our patients and our staff. By implementing this standardized bedside shift report tool, we will be able to adhere to those policies of AJA Hospital, and the procedures that we outline in order to use this policy will be explained accordingly.
So this training is going to be multiple steps that the nurses have to do in order to be completed. The first part is going to be this at-home hour-long online module, and it'll consist of videos, recordings, and then there will be a short quiz following to make sure that they have adequately understood the material. Following this online at-home portion of the training, there will be an in-person part of the training that will be where they discuss expectations of bedside shift report with their nursing leader. And this will take place somewhere during the first week of the year in January. And then if there are any new hires throughout the year, then they will just complete this entire training as part of their onboarding, and this will just continue each year.
Yeah, so that's the way that the trainings will work. And then what is the actual standardized bedside shift report that the nurses will be doing is it starts with, you'll have a piece of paper that has standardized information on it that goes into the patient's background, their health history, and then goes into all of their systems. And so you can write down any information about the patient as you go throughout your shift on that. Whether it is unchanging or it's new information, you write it down on that card. And that way, when you discuss it with the new nurse coming on, they have something physical and tangible that's written down, and there won't be any information that's lost that way. So you'll have that piece of paper when shift report is happening, usually at 6 p.m. or 6 a.m. And you'll take that and you'll sit outside of the patient's room with the new nurse coming on, and you'll just go through each section of that paper and answer any questions that the new nurse might have, any concerns, and you're really just trying to paint a picture for the kinds of cares that this patient will need in the next 12 hours to come. And so once you have that whole paper filled out, you've discussed it with your new nurse, then you can go in together with the paper with each nurse's, and you'll go into the patient's room and you'll meet the patient, and you'll double identify their name and their date of birth, and you will introduce yourself as the new nurse coming on. It'll be a time for you to check IV solutions, any lines and dressings, any concerns the patient might have, if they have any questions, this is a great time to ask those questions so that everybody is on the same page and there's no information that is lost between this whole shift change situation. And then from there, if everything is all well and good and questions have been answered, then you can go about your normal shift and carry about your care and do your cares as needed.
In order to make sure that the standardization tool and training is properly implemented, we will be holding everybody compliant by doing randomized nursing compliance checks. And how we will do that is by the nursing leader of the unit of the med-surg floor will have to do these randomized compliance checks of these nurses, and they will follow the nurse around for their shift and make sure that they are using the standardized tool that they have been taught and have been trained on throughout their shift. If they're found to be not compliant, then they will have to be retrained and will have to redo the training process.
Yes, and then this whole process will be repeated every year. Kind of similar how to like CPR training, you need to do that every 2 years. It's just something that the hospital is requiring that you keep up on. And then it will also be a great time as you review that every year to talk with your nurse leader about how things went the past year, if they caught any medical errors, if they saw any improvements in patient satisfaction. And this is just a great time to review. And so it'll be done every year.
Yeah. So basically, like, the purpose of this is just to improve patient safety and to help nurses and patients have better experiences and to improve their satisfaction. And all of our references can be found in our written outline. Thank you so much.